So the other day, the Centers for Medicare and Medicaid Services announced over a 5% increase in the payment rate to Medicare Advantage insurers. This is twice the amount that the Biden administration had proposed earlier. We know that these Medicare Advantage insurance companies, they already steal taxpayer money to the tune of $80 billion dollars all the way up to $140 billion dollars every single year. They use this just to line their own pockets and not to improve patient health. So while we're giving them more money, at the same time, the administration is saying we need to cut Medicaid and other important health programs. This is waste. This is theft in broad daylight, and it makes no sense for a program that has literally never saved taxpayers money. Again, it wastes hundreds of billions of dollars over several years. So according to the House budget resolution from February, the Republicans want to cut $880 billion from Medicaid over 10 years. That's on average $88 billion a year. That means that the overpayments to Medicare Advantage, big insurance companies like United Healthcare, is as much or more than enough to prevent any cuts to Medicaid. But instead of cutting back on these overpayments, as Dr. Oz said he might do in his confirmation hearing,
will you agree this morning, since you want to cherish Medicaid, to oppose any cuts to the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, Doctor. The question is, will you oppose cuts to this program you say you cherish? Time's short.
I want to make sure that the patients today and in the future have resources to protect them if they get ill, the way you protect Medicaid.
The records show that I asked a witness who said he cherishes this program, will you agree to oppose cuts? And he would not answer a yes or no.
They're literally giving more money to these companies, not to go to patient health, but to line the pockets of these executives. Because Medicare Advantage companies, they make money by the government gives them lump sum payments to cover patients, and they literally make money by spending as little of it as possible. That's why the care that when they provide coverage, there's delays and denials and constant trouble for people like normal citizens experience with regular private insurance, but now in the Medicare system. This entire scheme is just meant to enrich the donors of politicians. So currently, more than half of Medicare beneficiaries now are enrolled in Medicare Advantage. And proponents of the program say, look, this is evidence that the Medicare Advantage is great and it's delivering for patients. But what they don't say is that these companies spend millions advertising to people, promising great coverage, which they don't really provide, while traditional Medicare, the alternative, doesn't spend any money on advertising this. This money, these overpayments that go directly into the pockets of these companies, into their profits, before this rate increase, are enough to cover things like an $1,000 out-of-pocket cap for people on traditional Medicare, or to cover supplemental benefits for vision, hearing, and dental care. There are real problems with traditional Medicare, where there isn't a cap on out-of-pocket expenses for outpatient services, or people don't get that supplemental coverage, and that's why they often go to Medicare Advantage. We could literally have these things without cutting any actual essential part of Medicare Advantage, just the overpayments. But they're not going to do that. Instead, the administration is keen on giving more money to line the pockets and overpayments.